Morning, everyone. Good morning, ma'am, and good morning to all our media partners. For today, we will be giving updates on the Bayanihan 2 and the new benefit packages for our health workers, where Sec Percent will be presenting. We will be sharing the slide po.
So good morning, everybody. For today, before we start our question and answer, we will just present these updates on our health human resource under our Bayanihan plus 1 and Bayanihan to recover as one. So gusto lang ho namin ibigay ito para meron tayong updates no on these different benefits at saka yung mga naibigay na nating benepisyo para sa ating healthcare workers. Next slide, please. Next slide. So gusto lang namin iparating sa lahat na patuloy po nating binibigyang proteksyon ng ating healthcare workers hanggang sa ating makakaya. So dito po sa ating ginagawa, meron na ho tayo mga naitala na mga nagawa natin for these different provisions in the law, and shown here in this slide are the accomplishments that we have done already. Para dito sa Bayanihan to Heal as One Act ito, yung RA 11469, sa pag-facilitate ng ating augmentation of human resource for health under the emergency hiring for COVID-19 response, tayo ay nakapag-provide na ng 10,000 approved slots para sa 313 health facilities. Tayo rin, ang Department of Health ay nakapag-allocate na ng 47 million to support funding para sa provision ng special risk allowance ng COVID-19 hazard pay to some facilities and operational units. Tayo rin ay may total na 53,366 healthcare workers na nabigyan na natin ng one-time special risk allowance noong period ng ECQ. Samantala, meron tayong 83,379 personnel ang naka-receive ng COVID-19 hazard pay. Tayo rin ay nakapagbigay at patuloy pang nagpa-process ng mga grants para sa ating mga healthcare workers na na-infect ng COVID-19 or namatay dahil sa COVID-19 infection. As of August 31, 2020, ang compensation na 100,000 was already given to 36 healthcare workers who have contracted severe COVID-19 infections, while 31 beneficiaries have received 1 million peso compensation. Next slide, please. So dito sa continuing efforts natin against COVID-19, sa tulong po ng mga, of course, ng Congress, ng Senate, tayo ay nakapag-allocate 21 billion na budget na magagamit para sa ating response and recovery interventions for COVID-19. So ito po yung ating breakdown ng budget allocation. 13.5 billion was allocated in order to support health-related responses under Section 10, such as the continuous employment of existing and additional emergency health human resources for health, special risk allowance for all public or private health workers directly catering to COVID-19 patients every month, actual hazard duty pay for all healthcare workers, yung life insurance na sinama natin sa provisions, accommodation, transportation, and meals for all public and private healthcare workers, and compensation for healthcare workers with mild, severe, critical, and those who have died or will die from COVID-19. In relation to Section 10, B, a budget of 3 billion is being allocated for the procurement of face masks, PPEs, shoe covers, and face shields for local healthcare workers, barangay officials, and other indigent persons. And for Section 10C, the construction of temporary medical isolation and quarantine facilities, field hospitals, dormitories for frontliners, and expansion of government hospital capacity all over the country, a budget of 4.5 billion has been allocated. Next slide, please. As to the health-related responses, for the provision of continuous employment of existing and additional emergency health human resources, we are still continuing to target 10,000 slots in emergency hiring to augment our HRH. So for the special risk allowance to healthcare workers naman, 30% lamang po ng healthcare workers who directly cater to COVID-19 patients mula sa private hospitals ang makakatanggap ng special risk allowance kada buwan. Habang lahat naman po ng healthcare workers mula sa DOH at LGU health facilities ay mabibigyan ng special risk allowance. Nais po naming bigyang diin ang pagkakaiba ng provisions mula sa Bayanihan 1 at mula sa Bayanihan 2 ukol sa special risk allowance. Sa Bayanihan 1, ang one-time special risk allowance ay ipinamahagi sa mga healthcare workers during ECQ lamang. Habang sa Bayanihan 2 naman, ang special risk allowance ay maipapamahagi kada buwan sa lahat ng public or private healthcare workers who directly cater sa mga COVID-19 patients regardless of quarantine status. Pagdating naman po sa pagbibigay ng hazard pay, ang pinagkaiba nitong provision sa Bayanihan 1 ay ang duration kung saan ito ibibigay. Sa Bayanihan 1, ang hazard pay ay binibigay lamang tuwing ECQ. Pero sa Bayanihan 2, ito ay ipapamahagi again every month for the duration of 4 months regardless of quarantine status. Next slide. Target din natin makapagbigay ng provision ng free life insurance, accommodation, transportation, and meals for all of our healthcare workers in both public and private facilities, particularly to our healthcare workers without insurance who will be provided with a one-time payment of accident insurance. Furthermore, ayon sa Bayanihan 2, tayo ay patuloy na magpo-provide ng compensation para sa mga healthcare workers who contracted COVID-19 infections and compensation to beneficiaries of healthcare workers who died from COVID-19. Unlike in Bayanihan 1, which only grants compensation to healthcare workers who contracted severe and critical infections, sa Bayanihan 2, may additional provision para sa compensation to those who have contracted mild COVID-19 infections in the amount of 15,000 pesos. Next slide, please. Para sa Section 10B, tayo po ang provide ng face mask, PPEs, shoe covers, and face shields para sa lahat ng mga local health workers para sa kanilang pagganap sa kanilang mga trabaho sa ating mga primary healthcare facilities and other local facilities. Ayon naman po sa Section 10C ng Bayanihan 2, meron pong 4.5 billion na allocated para ma-finance ang mga construction ng temporary medical isolation and quarantine facilities, field hospitals, dormitories for frontliners upang mapalawak pa ho natin ang government hospital capacity across the country. Sa tulong ng mga provisions nitong Bayanihan 2, patuloy po tayo makakapagbigay ng karampatang suporta para sa ating mga healthcare workers sa buong bansa, both public and private. So dati wala ho tayong masyadong benefits for private healthcare workers, pero ngayon sinigurado po nitong batas ng Bayanihan 2 na meron na ho both public and private. Wala ho tayong sisinuhin na healthcare workers. All of them will be provided as long as they directly cater to COVID-19 patients. So iyon lang yung ating presentation for this update.
Thank you, ma'am. Thank you, ma'am, for giving updates on the Bayanihan 2. We will be sharing the slide deck to our media partners later. To all our media partners, if you have questions related to Bayanihan 2 and the new benefit packages, we will collate all questions and we will relate to the proper office of the Department of Health. Salamat po. We will now move on to the regular media forum. Ma'am, regarding the Secretary of Health's activities, can we have an update on the repatriates who have recovered from COVID-19?
Yes, we just like to give information. No? So kahapon kasi ng umaga, 230 returning OFWs or Filipinos ang dumating sa bansa, na dumating sa bansa noong mga nakaraang linggo ang na-clear na sa COVID-19 at napayagan ng makauwi sa kanilang mga pamilya. Sila po yung mga kababayan natin na mula sa iba't ibang bansa na nagpositibo sa virus nung atin silang itinest pagdating dito sa Pilipinas. So they were quarantined. They stayed at our mega drug abuse treatment and rehabilitation center sa Fort Magsaysay, Nueva Ecija, which was originally intended, alam natin lahat, na rehab facility ito. Pero ngayon, ito muna ay pansamantalang ginagamit as a temporary treatment and monitoring facility. So ang paalala lang ho namin sa kanila, pinaalalahanan po sila ni Secretary Duque kahapon, nung nagsalita si Secretary Duque bago sila umuwi, na dapat pagmula sa kanila yung mga bida habits, and they should be part of the bida solution. So tandaan lang ho na dapat nila yung ating mga bida mga practices, So yung magmamask lagi mag-uugas ng kamay, physical distancing, and of course, always alamin ang tamang impormasyon. So that is our update for yesterday's visit of the Secretary to Fort Magsaysay.
Thank you, ma'am. We'll be now moving on to the questions submitted yesterday. For the first question, Alden Monzon, Kyodo News, and Christian Yosores of Bombo Radio Philippines asked the same question. They're asking for updates on the vegan trials and if it was able to start yesterday, September 1.
Hindi po ito naumpisahan kahapon, kasi nagkakaroon tayo ng delays dito sa mga ethics review among the different identified hospitals na kasama dito. So itong ethics review po ng Jose N. Rodriguez Memorial Medical Center, Santa Ana Hospital, at saka yung Quirino Memorial Medical Center, hindi pa po ito na-final. Yung sa PGH naman po, yung MOA is currently for review na ng legal review na po ng UP Manila. Pero meron na po silang approved ethics na review. So ang inaantay ho natin yung tatlong ospital para makapag-final na po ng approval for the ethics review. Ito pong isa pa ay yung ating clinical trial agreement. Kailangan lang ho ma-finalize. Nakuha na ho natin lahat ng inputs coming from our legal offices, and ito na lang ho ay pipirmahan ni Secretary Duque. So ito yung dalawang pinag-aantay natin para tayo ay makapag-umpisa nitong vegan trial. So once all of this had been processed and had been approved, we will already start. So again, I repeat, there are 4 hospitals that has been identified for this vegan trial. 100 pasyente ang ating gagawin. 4 na ospital, PGH, Jose N. Rodriguez Memorial Medical Center, Santa Ana Hospital in Manila, and also Quirino Memorial Medical Center. Nick?
Thank you, ma'am. For the next question from Caroline Bongkin of CNN Philippines. Any update on the vaccine experts review on the Sputnik V documents? Ano na rin po ang development sa clinical trial for the possible COVID-19 treatments? May natapos o patapos na po ba? May promising results na po ba?
Tulad nung sabi namin, itong Sputnik 5, hindi pa sila nag-umpisa ng clinical trial nila. Ang sabi sa amin noon, August sila mag-uumpisa for the phase 3 clinical trial sa Russia. Sila ay nag-umpisa lang ng pagpatupad nito among several healthcare workers in Russia. Pero ito is through the emergency use approval ng kanilang gobyerno. Pero yung talagang formal na phase 3 clinical trial, hindi sa pagkakaalam namin, dapat nag-umpisa noong August. But we still need to get information. Pinag-aaralan pa rin ng ating vaccine experts panel itong phase 1 and phase 2 trials na nangyari para dito sa Sputnik 5 at magbibigay sila ng impormasyon sa atin kung ito ay magiging acceptable at saka kung ito ay magiging feasible na pag-usapan na magkaroon din ng phase 3 clinical trial dito sa ating bansa for the Sputnik 5 vaccine.
Thank you, ma'am. For the next question, Lanesca Panti of GMA News Online. Caroline Bongkin of CNN Philippines also has the same question. They ask if the Senate Committee of the Whole recommended the filing of graft and malversation charges against the Secretary of Health as chair of PhilHealth Board over PhilHealth's legal release of IRM and PhilHealth's IRM releases to facilities not accredited by PhilHealth and those with pending fraud cases. How will the DOH address this po, given that the SOH is the chair of PhilHealth Board?
Nagpalabas na ng statement kagabi si Secretary Duque. No? So unang-una, ang kanya namang ipinaparating, just like with any other inquiries or this kind of processes, bukas naman lagi no, si Secretary Duque para sa mga ganitong processes so that para lang malaman yung totoo at siya naman ay willing and he will cooperate. Para lang din, of course, he wants to clear his name as he has been ang tagal na niya dito sa trabaho sa gobyerno, no? And this itong mga ganitong circumstances, gusto niya nakaklaro. So he will cooperate with this investigation. Pangalawa, sinabi niya rin dun sa statement niya, no? And this is a fact. Nawala siya nung time na nagdesisyon ang board ng PhilHealth para dito sa IRM na ito, and he even stated na hindi siya pumirma doon sa dokumento o resolution ng PhilHealth Board regarding the IRM. Pangatlo, according to Universal Healthcare Law, non-voting member ang Secretary of Health dito sa PhilHealth Board. So itong tatlong mga statements na ito yung pinalabas niya kagabi at iyan naman po ang kanyang sagot dito sa mga lumalabas na artikulo na there is this investigation that will be undertaken by the Senate and the other agencies regarding this matter.
Thank you, ma'am. For the next question, Christine Sabelo of ABS-CBN. Her question is related to Red Mendoza's of the Manila Times question. Let me just read the question po. The Filipino Nurses United held a dialogue with the Department of Budget and Management yesterday regarding the budget circular raising the salaries of nurses to salary grade 15, but has demoted the nurse plantilla items, particularly nurse 2 to 7 positions. The DBM said that they have consulted with the department and the Civil Service Commission before the issuance of the said circular, but the FNU said that the modification of the suffixes were an insult to their hard work. We have a clarification from the DOH regarding the suffix items on nursing positions in the government.
Unang-una, gusto namin iparating na we recognize yung efforts ng mga nurses natin, and we know that they play a critical role, especially in this pandemic response. And even nung wala pang pandemya, alam natin ang kahalagahan ng ating mga nurses. Kaya nga talagang isinulong ng Department of Health itong pagtataas ng entry level ng salary ng ating mga nurses para naman mabigyan sila ng karampatang recognition. Now, with regard to this alleged demotion, hindi naman po ito demotion, niretitle lang yung kanilang mga plantilla positions. No? So it's not really demoting them, but just retitling. Meron ng mga ganitong move lagi ang DBM and together in collaboration with civil service para lang maiayos po yung structure ng plantilla position sa government. Minsan ho kasi nagkakaroon ng duplication, minsan nagkakaroon ng confusion, kaya inaayos po nila yan, nire-retitle po nila. But there has been no demotion. But anyway, this has been noted already by our council, the Magna Carta Council, no? At ito po ay tinitignan na nila dahil ito po namang council na ito is concerned with the welfare of all of our healthcare workers. So titignan po nila yan at magbibigay sila ng proper guidance for that para naman marinig din nila yung hinanaing nitong ating mga nurses na kasama dito sa nagko-complain or nagbibigay ng kanilang mga hinanaing. Nick?
Salamat po. For the next question from Claire Zhao of Bloomberg. What was our case doubling time, case fatality doubling time, and RO for August, and how do these indicators compare to previous months?
Ang case doubling time, as we all know, is the measure of the speed of transmission. So, halimbawa, mas mahaba yung doubling time, mas lower ang spread ng transmission. So, as of August 31, ang ating case doubling time ay 10.08 days. This means that it takes 10 days ngayon, as of August 31, para magdoble ang kaso dito sa ating bansa. The longer the case doubling time, as I've said, the slower the spread of the infection or transmission, and this is better for us. The mortality doubling time, ganun din yun. It is the number of days it takes for the number of deaths to double. So, longer mortality doubling time, mas good yon sa atin. Ano? So, our mortality doubling time has improved from 0.96 days in March to 8.29 in June. And now we have 14.67 days. So, ibig sabihin, it takes about 15 days bago magdoble ang number of new deaths dito sa ating bansa. So, the higher the number, as we have said, the better. So, ito pong mga ginagawa natin, pag nakita natin case doubling time, case mortality time, and even the reproduction number, nakikita natin nag-i-improve yung ating mga indices, or indicators. And this can very well reflect yung response naman na ginagawa natin, that we are really aggressively trying to contain the transmission in our communities. So yung reproduction number po natin, ito yung possible number ng mga tao na pwedeng ma-infect ng isang taong may sakit ng COVID-19 at a specific time and with control measures in place. So ang goal po ng reproduction number is for us to have less than 1 para ma-sustain natin yung ating mga ginagawa dito. So ngayon ang reproduction natin, number natin, dati 1.5037 nung March 15, nung June naging 1.17, and now ngayon 0.977 po tayo as of August 31. So ibig sabihin, every single infected person dito sa Pilipinas can only infect about 1 person. Compared from the previous. So, ito po ay katulad ng sabi ko, maaring nagiging effective na yung ating mga ginagawang measures. We are able to control yung spread, nung ating, yung mga may sakit dito, yung spread ng infection natin. Pero, ang gusto ko lang sabihin, we have to be cautious in interpreting again these different indicators. Marami pong pwedeng maka-affect ng indicators na ito, maraming factors. Pangalawa, ito pong case doubling time, meron na hong mga ginawang pag-aaral and analysis ang ating grupo dun sa FASTER, yung sa technical working group ng analytics, at parang nakikita nila na ang case doubling time po ay hindi masyadong sensitive na makakapture niya talaga yung true picture ngayon kung meron tayong community transmission sa iba't ibang lugar. Kaya ngayon po ginagamit na rin yung attack rate at saka incidence rate para po mas maging buo ang analysis ng ating sitwasyon ngayon sa pandemic. We will be sharing all of these numbers to you in our Viber group. Nick?
Thank you, ma'am. For the next question from Christine Sabilo of ABS-CBN. Kailan madadagdag si Dr. Senen sa tali ng health worker deaths? Yung 40th kasi ay nursing assistant and not a physician based on the last data drop.
Inaantay pa natin yung disease reporting unit na ibigay sa amin ng kompletong impormasyon. Katulad ng lagi naming sinasabi sa inyo, we cannot tag an individual as a true death para malagay natin sa ating talaan kung wala pang cause of death at wala pang date of death. So, kailangan maibigay mo na sa amin ang proper documents. And of course, for us to be able to facilitate the release of this benefit for the family or beneficiaries of Dr. Senen, kailangan complete po ang dokumento so that we can validate. So, inaantay pa rin ho namin yan and we are closely coordinating with them.
Thank you, ma'am. For the last question submitted yesterday, it was from Sandra Samala of PTV4. A nurse po from the National Kidney and Transplant Institute in Quezon City is raising her concern about what happened po sa father na in Camarines Sur. Hindi daw po umano tinanggap ng Dr. Robosa Hospital dahil mula raw po sila sa area na maraming kaso ng COVID-19. Ang father niya noong nanghihina na ito at hindi na kumakain. Hindi rin daw po ito natulungan ng Municipal Health Office. Kalaunan ay pumanaw na po ang father ng nurse na hindi nalalaman ang cause of death dahil wala raw pong tumanggap na ospital. Can the DOH check on this po? And how can we make sure na tumatanggap pa rin po ng COVID patients ang mga ospital?
Unang-una po, gusto lang ho namin ipagbigay alam sa lahat na ang DOH po, ang ating goal para dito sa ating response is to reduce deaths for COVID and non-COVID. So ibig sabihin, ni-retain po namin yung pathway ng non-COVID. Dahil alam naman po natin na hindi po natin pwedeng tanggalin ang non-COVID pathway para sa mga pasyente dahil hindi lang naman po COVID-19 ang mga sakit dito sa ating bansa. So we have ensured that all of our health facilities should be retaining their non-COVID units or beds. Kaya nga po pag tinignan natin, we are just saying, no, and our policies would dictate, no, and mandate hospitals to assign, no, or allocate 30% of their bed capacity. Kasi alam po namin na hindi nila pwedeng totally ibigay sa COVID ang kanilang mga beds dahil meron po tayo mga non-COVID patients. And the reason for just the 30% and for private is just 20% because we understand na mas marami pa hong pasyente na non-COVID ang kanilang mga complaints, no, at hindi lang talaga COVID. So meron ho rin ho tayong batas, no? Gusto ko rin hong ipagbigay alam sa inyong lahat at sana po matulungan nyo kami kapag may mga ganito pong mga ospital na tumatanggi sa ating mga pasyente. Kailangan pong mai-report agad yan sa DOH para maimbestigahan natin at masanksyon po natin ang ospital. Bawal hong tumanggi sa mga pasyente kung hindi po talaga kaya ng ospital ang mag-manage yung pasyenteng dumating sa kanila. Nakalagay po dun sa batas na yon that they should stabilize the patient first, assess the patient kung ano ang problema, and then refer the patient. Hindi ang pasyente ang maghahanap ng ospital para sa kanila. The hospital should find a referral hospital where they can send the patient kung hindi nila kaya. So ito pong nangyaring ito, atin pong iimbestigahan ito. No? Papupuntahan ho natin yan sa regulatory officers natin para malaman natin kung ano po talaga ang nangyari. And once found na nag-violate po sila, we will be sanctioning this hospital. We have this hospital committee kung saan tinitignan po lahat ng violations na ito at ibibigay ho natin itong impormasyon na ito doon para mag-umpisa na ho ang proseso.
Thank you, ma'am. Those are all the questions submitted from yesterday's link. Ma'am, do you still have time to accommodate a few questions po?
Yes, Nick.
Opo. Let's start po with the first media partner, Ms. Aiko. You can ask the question yourself.
Good morning po, Yusek.
Morning, Aiko.
Yusek, just like to ask about the situation po kagabi sa Manila. May mga kumalat po na rapid test kits along Trabaho Market. Nalaglag daw po sa isang sako ng magbabasura. Natakot po yung mga residente and hindi na po alam kung paano nila lilinisin ng barangay. Ano po ang protocol ng DOH po sa disposal po ng mga nagamit ng rapid test kits and collection po nito and after using saan po ito dinadala? With the incident, may sanction po ba ang isang testing center or facility na gumamit po ng mga kumalat na test kits? Yun lang po, Yusek.
Thank you, Aiko. Unang-una, yes, there is a sanction for all of these healthcare facilities na hindi nila tinatapon ng maayos ang kanilang waste, no? Let us try to understand na ito pong mga rapid test kits na ito po ay healthcare waste. Ibig sabihin kapag healthcare waste, mas iba ho ang treatment niyan kaysa sa ordinary na mga waste products natin katulad sa bahay. Dahil ito po ay maaring makapanghawa at maaring makapag-cause ng harm sa mga tao, no? Katulad niyan, nalaglag doon sa kalye, o kaya ay baka hinahawakan lang po ng mga nagkokolekta na wala silang gloves, no? And they can easily get infections or be harmed, no? Dito po sa mga practice na ito. Nananawagan po kami sa mga local government units at saka po sa ating mga healthcare facilities. We have policies, we have protocols para po sa disposal, proper disposal ng ating mga healthcare waste. Ito pong mga ginagamit natin for the COVID-19 response, itong ating mga PPEs, itong ating mga kits or testing kits or diagnostic kits na ginagamit at iba pa ho na mga ginagamit for our patients. Ito po ay considered as healthcare waste. It should be treated differently. Alam po ng healthcare facilities namin kung ano ang proper disposal. It should be placed in a bag na meron pong label yan na healthcare waste yan. Meron ho tayong mga designated na mga pinaglalagyan itong healthcare waste natin as approved by the Department of Environment and Natural Resources, no? So hindi po dapat ito kung saan-saan lang tinatapon. Again, may I remind all of our healthcare facilities, it is part of your licensing na may protocol po tayo na requirement na dapat proper po ang disposal ng ating healthcare waste. So kapag ka po nakita natin that you are not disposing your healthcare waste properly, then there would be accorded sanctions for this.
Yusek, malaman lang po namin, ano po yung pwedeng sanction na kaharapin ng isang testing center na lumabag po nitong disposal?
Meron naman tayong in general na sinusunod ng mga patakaran. So una, we issue warnings. Kapag hindi ka pa rin sumunod, we will suspend you. And the final would be revocation of your license. Aside from that, kung meron pang tatamaan na ibang batas with regard to this healthcare waste, maipapataw pa rin natin sa kanila itong mga sanctions na nakalagay sa batas na ito. But definitely, their license will be at risk.
Ma'am, sorry po, last one. Saan po usually tinatapon yung mga healthcare waste po? May separate po ba siyang dinadalhan, especially when it comes to test kits?
Yes, there is a separate disposal area for healthcare waste. Kaya yan, katulad sa mga ospital natin, separate po yan na kinukuha ng ating mga kakontrata nila. Actually, our healthcare facilities, they have this contracted mga healthcare disposal na mga firms na kung saan ito po ay meron silang sariling pinagtatapunan itong mga waste na ito, or yung iba naman meron silang incinerator. So iba't ibang klase pero separate po talaga siya. So when it comes to this, kailangan ng ating mga licensed laboratories, for example, or healthcare facility, if they should coordinate with their local governments kung wala silang kakontrata ng mga ganito. Kung hindi naman, kailangan makipagkontrata sila on their own. That is part of their responsibility.
Thank you po, Yusek.
Thank you po. For the next question, we have Rafael Bosano.
Good morning, Yusek. Ma'am, magtatanong lang po ako about contact tracing again. Is the DOH able to monitor contact tracing in local governments? Kasi po some COVID patients have been saying na parang hindi daw sila constantly na monitor. Tapos yung details na binibigay sa kanila, such as the number of days that they need to be in isolation and quarantine, medyo confusing daw, tsaka hindi pare-pareho. So how can contact tracing be effective if there are problems such as this? Tsaka paano po yung pakikipag-usap ng Department of Health with the local governments?
Actually, Rafi, itong contact tracing, this is really the task of our local government units through their barangay health emergency response teams. Nakita natin na meron tayong konting gaps dito sa pagpapatupad ng contact tracing, kaya tayo nag-recalibrate ng ating strategy. Kung matatandaan nyo, during the time na nag-MECQ tayo this past month, tayo ay nagkaroon itong code strategy kung saan kasama dyan yung appropriate and adequate contact tracing. That's why there was this czar that was assigned by the President as Mayor Magalong, and we are adopting the Magalong formula, yung 1:37. So ibig sabihin, isang tao na makita mo na mayroong sakit ng COVID, kailangan at least 37 individuals ang makontact trace mo para masabi natin na appropriate and adequate ang nagawa mong pagko-contact trace. Now with these different gaps dito sa pagpapatupad, unang-una gusto lang nating sabihin na italaga ng IATF, ng DILG, or ang mag-head ng contact tracing efforts. But of course, DOH is still there. We provide standards, we provide guidelines. We also do monitoring, aside from DILG. But we work closely with them para nakakakuha kami ng appropriate na datos. So dito nga sa ginawang assessment, bago magkaroon itong recalibrated strategy, nakita ni na Mayor Magalong na marami talagang mga gaps and weaknesses sa contact tracing sa local governments. Nakita nila na mababa ang numero na nakukontact trace ng ating mga local government officials. Ang kanilang average is 1:5, 1:6, 1:4. So ito naman, nakapagbigay ng guidance si Mayor Magalong based sa mga resources ng ating mga local governments. At ito nga ang sinusulong natin ngayon, itong formula ng 1:37. But what would be most important, Rafi, is not really the ratio. Sabi nga ni Mayor Magalong, yung number na yan parang benchmark lang natin yan. Para alam natin, if we're hitting it, we're good. If we're not hitting it, we should do more. Pero what's most important would be what we do beyond the numbers. Yun ang lagi namin ine-emphasize sa mga local governments. Makakuha ka ng 37, okay, you have reached the target. Pero ano ginawa mo dun sa 37 na yon? Did you immediately isolate them within 8 hours? Ikaw ba ay nakapag-contact trace pa further after nun? So ito yung mas importante sa atin ngayon at ito ang minomonitor ng DOH. We are now currently drafting this contact tracing form kung saan ire-revisa natin ng konti. Lalagyan natin ngayon ng time elapsed. From the time that you have identified the COVID-positive individual, gaano ka katagal na nag-contact trace, gaano kabilis ka nag-contact trace, at gaano kabilis mo na isolate ang isang pasyente when you have done your contact tracing. Kasi nga, maraming nangyayari, inaantay pa ang resulta bago mag-contact trace. So we have given that instruction already and guidance na kailangan kahit na hindi pa lumalabas ang test results, once na-identify mo na ang pasyente or individual is a suspect or a probable, kailangan umpisa na ang contact tracing. Hindi natin naantay ng test result. Pag dumating ang test result, well, mababago lang ng konti yan, pero ganun pa rin ang gagawin natin. All close contacts, they have to be quarantined or isolated. So ito yung mga binibigay nating guidance ngayon sa local government units as we do our coordinated operations to defeat epidemic. Hopefully, contact tracing will improve in the coming weeks, lalong-lalo na ngayon with the guidance of Mayor Magalong as our contact tracing czar.
Last na lang po, clarification lang. Every day po ba dapat kumokontak ang isang contact tracer sa isang naka-isolate just to monitor if there are any developments of symptoms, tsaka para malaman kung sila ba ay baka lumalabas, no? Kasi nagkakaroon din ng problema with patients telling the truth.
Yes, Rafi, alam mo, tama iyan sinasabi mo, no? And that's the function of the Barangay Health Emergency Response Teams. Ang BHERTS natin, marami po silang function, ano? Yung iba sa kanila, nagko-contact tracing. Yung iba sa kanila, taga-monitor ng mga pasyente natin na nag-home quarantine. Yung iba naman sa kanila, na-assign sila dun sa mismong isolation facilities ng local governments. So ito po, ganito ka-wide ang yung expanse ng mga responsibilidad ng ating Barangay Health Emergency Response Teams. Kaya nga po, napaka-critical ng role. So yes, they have to be monitored ang mga pasyente sa bahay araw-araw, no? Meron ho silang proseso diyan kung saan may binibigay na contact detail yung taong pinomonitor natin at araw-araw nagtatala kung ano yung temperature niya, may nadagdag ba sa simptomas, naibsan na ba yung kanyang initial symptoms. Lahat ng ito binomonitor for 14 days and then after 14 days that would be the basis para i-clear yung pasyente kung pwede na siyang mag-reintegrate sa community or pwede na siyang bumalik sa trabaho.
Thank you, Yusef.
Thank you, ma'am. For the last question from Mr. Joe Vicky of Enquirer.
Good morning, Yusek.
Morning, Jovic.
Ma'am, magtatanong lang po ako regarding dun sa pinost ng Manila Local Government over the weekend. Meron daw po silang na-receive na 976 na Avigan tablets from DOH, pero yung picture na nasa Facebook nila is the generic favipiravir from China. Yung mga tablets po ba na to, galing talaga to from DOH? And kasama po ba yung hospital ng Sampaloc dun sa Avigan trial sites natin?
Yes, Jovic, ang sa Manila, Santa Ana Hospital, hindi hospital ng Sampaloc. Pero ang Avigan kasi, aside from this trial that we are going to have, meron pong nag-donate sa atin ng I think 199,000 tablets, no, of this Avigan medicine. Binigay ito through the National Security Council ng Pilipinas at ibinigay naman ng National Security Council sa DOH para magamit. So itong mga Avigan na ito, atin pong i-distribute na sa iba't ibang ospital through the compassionate special permit. No? Hindi siya kasama dun sa clinical trial. Kailangan lang, they have to undergo this process for regulating this, no? Para na sisigurado pa rin natin na magiging ligtas ang paggamit nito at gagamit tayo nitong compassionate special permit from FDA. So yes, nagbigay po kami. And yes, Chinese po, hindi po Japan, no? Dahil ito po ay dinonate sa atin through the National Security Council.
Ma'am, yung sa Cavite lang po, kasi mag-start na daw po sila nung clinical trials nila for a vaccine. Pero mukhang essentially this is a phase 3 clinical trials kasi ang target nila is 10,000 na patients. Coordinated po ito sa DOH and maybe know if may information kayo kung anong vaccine yung ita-try out nila.
Nung Sabado, no, I read the article at may nagbigay na ng report sa atin. So we immediately contacted the proponent, no? Ito yung leader nung magre-research. And we have discussed with him kung ano dapat yung proseso. And he should and they should notify DOH. At nagkasundo naman kami at ang sinabi naman, they would be regularly updating us kung ano na yung magiging estado. Sa ngayon, they are still trying to negotiate at i-final pa rin nila yung kanilang protocol. So they will undergo the process of regulation, go through FDA, and then after that would have the ethics review. At pagkatapos nun, ino-notify na nila ang DOH para maumpisahan na. Wala pang detalye na isinasubmit sa atin yung proponent. No? Once we get it, we will be giving all of you the information as well.
At clarification lang, ma'am. So ibig sabihin po, until ma-process nila lahat ng requirements na na-mention niyo po, hindi sila pwede mag-start in the next 2 weeks. Tama po ba?
Of course. Yes, Jovic. Walang pwedeng mag-umpisa ng any clinical trial kung wala kayong approval ng FDA at wala kayong approval ng ethics review. If you do that, you are violating specific laws. So you will be sanctioned and you will be asked to stop. We have to remember, no, itong clinical trials na ginagawa natin, especially for these vaccines and the new medicines, this involves individuals, no, mga tao. So kailangan nare-regulate ng gobyerno para masiguro natin na magiging ligtas ito para sa ating mga kababayan. Kapag hindi po dadaan sa ganitong proseso, hindi natin masisiguro na ligtas yan. And that might cause harm to our citizens, no? So kailangan pong dumaan sa regulatory process bago po sila makapag-umpisa.
Thank you po.
Thank you po. Those are all the questions we can accommodate for today. Thank you po to all our media partners. Yusek, if you can give a final message to our media partners before we conclude today's forum.
Yes, I'd just like to give this again. We have this final key message. So it's about protecting our healthcare workers. And hindi lang po one time, big time na kasi merong batas na Bayanihan 1, nagkaroon ng Bayanihan 2. We will continue to protect them. No? So makakaasa po sila sa DOH na patuloy po kami makikipag-ugnayan sa ating mga healthcare and allied healthcare organizations and associations upang mabigyang tugon po yung mga pangangailangan ng ating mga healthcare workers. Atin pong sinisiguro, no, na mas comprehensive na ang benefit packages ng ating healthcare workers nang mabigyan sila ng nararapat na suporta sa kanilang ginagawa para sa atin at sa kanilang pag-aalaga sa mga COVID-19 patients. Ang ating pong mga healthcare workers ay kasama ng iba pa nating mga kasangga na mga frontliners na alam natin, napaka-importante sa laban natin sa COVID-19. Mula sa prevention hanggang sa reintegration ng ating mga kababayan, sila po ay kasama natin. So if you would notice, no, start from prevention, detection, isolation, lahat po yan hanggang sa ma-reintegrate, yung healthcare workers pa rin po natin at mga frontliners ang nag-aasikaso sa atin. So atin pong, we condemn, no? Kinukondena po natin kahit anong uri po ng discrimination at saka violence against our healthcare workers, against our frontliners. Nakikiusap po kami sa lahat ng ating kababayan na suportahan po natin sila. Sila po yung ating pinaka-critical na mga tao ngayon, no, dito sa laban ng COVID-19 dahil sila po ang nag-aalaga sa ating mga pasyente at sila po rin ang nagbibigay tugon, no, sa iba't ibang strategies na ginagawa natin laban sa COVID-19. Kami po dito sa Kagawaran ng Kalusugan ay kasama po ng ating mga healthcare workers sa laban na ito. So gusto lang po namin iparating again sa ating mga healthcare workers, kakampi niyo po kami, patuloy po namin kayong bibigyan ng suporta at pangangalaga. Kung meron po kayong mga hinanaing, maaari po kayong sumangguni sa amin para mapag-usapan po natin na mas maayos ito pong mga hinanaing na ito. So yan lang po ang aming maibibigay sa inyong lahat ngayon. This ends our media forum. We will see all of you again on Friday. Ibibigay po namin at ipopost sa ating Viber group lahat po ng mga questions na hindi namin nasagot sa ngayon. And also, ito pong ating mga tables para sa mga numero na kailangan nyo po. So thank you again, and Nick, maraming salamat. See you
Thank you
all
po,
on
ma'am.
Friday.
Thank you everyone. Salamat po.